Carla Whorton, AGNP here, specializing in hormones, lipedema, and weight resistance. Educational purposes only, please. Postpartum depression is not sadness. It is panic you cannot shut off. It is not sleeping even when the baby sleeps. It is intrusive thoughts, emotional numbness, rage, guilt, and exhaustion that feels unfixable. And if you have lipedema, postpartum depression doesn't just affect your mind, it can permanently worsen your disease. What is really happening after delivery? After birth, estrogen and progesterone fall faster than at any other time in a woman's life. Progesterone drops overnight. The calming neurochemistry it supports disappears. At the same time, prolactin rises to support breastfeeding. And here's what almost no one explains. High prolactin suppresses dopamine. Dopamine is motivation, pleasure, drive, and resilience. When dopamine drops, women feel flat, overwhelmed, disconnected, and joyless. Prolactin also disrupts serotonin signaling. Serotonin helps stabilize mood, calm anxiety, and regulate sleep. So now we have low progesterone, low dopamine, low serotonin, severe sleep disruption, and a nervous system stuck in survival mode. This is not psychological weakness. This is neuroendocrine collapse. Why lipedema makes postpartum depression worse. Lipedema is an inflammatory disease. It involves pain, amplification, impaired lymphatic flow, and inflamed fat tissue. Postpartum hormone withdrawal increases cortisol. High cortisol worsens insulin resistance. Insulin drives fat storage and inflammation. Sleep loss amplifies pain. Inflammation accelerates fibrosis. Lymphatic congestion worsens. Many women with lipedema say that postpartum period is when my body changed forever. They're right. What has traditionally been offered? Historically, postpartum depression was treated as purely psychiatric. Women were given antidepressants, I know I was, told to wait it out, told it was normal. SSRIs can help some women, but many still don't sleep. Many feel emotionally blunted, and none of this replaces the hormone that were stabilizing the brain days before delivery. What was missing was the hormone withdrawal itself. Why synthetic hormones cannot be used. This part is critical. Synthetic hormones are not the same as bioidentical hormones. Synthetic progestins do not convert into calming neurosteroids like allopregnanolone. They do not support GABA signaling. They can worsen mood, anxiety, and inflammation. Synthetic estrogens increase clot risk postpartum. They suppress natural hormone recovery. They do not replicate physiological brain signaling. This is why synthetic hormones are not appropriate for postpartum depression. You cannot treat a neurosteroid withdrawal with a non-neurosteroidal molecule. How bioidentical progesterone helps. Bioidentical progesterone is identical to what the body makes. It restores the pathway to allopregnanolone, the brain's most powerful calming neurosteroid. It improves sleep, it reduces anxiety and agitation. It stabilizes the mood without emotional numbing. It affects the GABA receptors, making us go, ah, and sleep. The biological is so real that modern postpartum depression treatments are now based on restoring this exact neurosteroidal pathway. How pregnenolone helps? Pregnenolone is the parent hormone. Under stress, sleep deprivation, and inflammation, many women cannot make enough of it, or their bodies shun it straight into cortisol. Low-dose pregnenolone supports hormone recovery upstream. It improves stress tolerance. It supports cognitive clarity. It helps the body stop living in emergency chemistry. Why this matters for lipedema. Better sleep lowers cortisol. Lower cortisol improves insulin signaling. Lower inflammation protects lymphatic and fat tissue. Stabilizing hormones postpartum is one of the most important opportunities to prevent long-term worsening of lipedema. This is not cosmetic care. This is disease-modifying care. Postpartum depression is real. Lipedema is real, and suffering in silence is not required. If you're struggling after birth, especially if you have lipedema, you deserve care that treats your brain, not your brain and your hormones and your body altogether. There is science behind this. There is help, and you are not broken. See me regarding your lipedema, your postpartum lipedema, or ask your provider about bioidentical, progesterone only, never synthetic, and please have the correct test to begin with.